And the newer concepts are that it's a customer-client relationship. I think it's somewhere in the middle. I think while I don't have all the answers, I'm not always right. I think it is a partnership, and my role with the patient is really to help them understand their values, help them understand what their goals are, and help them get to those goals. My goal for each patient visit is really based on my first question, which I ask patients, which is, what brings you in today? And not only is that just trying to find out what their express reason to come in, really trying to figure out what their motivation is, what brought them into the doctor today. Was it a certain goal they had, or a certain fear they have, or if their spouse is just trying to nag them to come in. Really trying to find out what a patient's motivation is the key to figuring out how to serve them best. I chose family medicine for two reasons. One was the breadth and scope of the discipline. I enjoy taking care of children, younger adults as well as older adults, the whole spectrum of life, and also the variety in terms of being able to take care of chronic illnesses, but also being able to sew up a laceration at the same time. Secondly, I really feel like all my role models in medical school were family doctors. They really had an emphasis on looking at the whole patient from a holistic perspective and understanding that health is basically determined by not just your individual lifestyle, but everything around you, from your family to your culture and your upbringing. I would hope that my patients describe me as a good listener. I try my best to really give them the time to speak during an interview, as well as follow up over the phone. I really try to figure out what it is that they really want out of the visit. The most rewarding part of my day really is just meeting all the different types of people that I get to meet. I get to meet people from all different walks of life. I've met people from 6 different continents. I've met people who've lived through wars, and being able to talk to them, being able to hear their life stories and put that in the context of their health, and trying to understand who they are as a person.